All right, today on the show we have Dr. Kristin Kirkby Shaw. She's the founder of CARE, Canine Arthritis Resources and Education, a free online resource to help veterinarians and pet parents better understand and manage their dog's arthritis. Kristin is a small animal surgeon and rehabilitation specialist. She's dedicated her career to treating arthritis and has spent 2 decades developing techniques to help dogs who are suffering from it live healthy and active lives. She's also the medical director of Sound Veterinary Rehabilitation Center, instructor for the Canine Rehabilitation Institute, and recipient of the John J. Sherman Award for Excellence in Veterinary Rehabilitation. You can learn more about Dr. Kristin at caninearthritis.org, where she has a free download for you called The 7 Principles of Exercise. And you can also follow her on Facebook at Canine Arthritis and on Instagram at canine_arthritis_resources. Dr. Kristin, thanks for being on the show.
Thank you so much for having me. It's great to be here.
All right. Why don't you take a second to fill in anything I might have missed there, and we'll get right into things.
Sure. That was pretty thorough. Just a little bit of my background. I did my vet school training at the University of Florida and stayed on for a small animal surgical residency. And so as a surgeon, back when I was training, canine rehabilitation was pretty new. There were 2 training programs, but not many people out there actually in practice doing it. As a surgeon, I recognized that there were a lot of things we could do really well surgically, but a lot of gaps that needed to be filled in non-surgically. And so I went through and did a lot of training in rehab, and my focus, my goal is to try and bridge that gap between surgery and rehab. And arthritis really is kind of that disease process or that condition that bridges both. So while most of my days are in the clinic are spent doing surgery and treating dogs surgically, there are so many things we need to talk about on the non-surgical and long-term arthritis management side that it's kind of how I got to where I am. The other thing I would say is having my own dogs with arthritis has taught me as much, if not more, than what I can read in a book or learn in a conference.
And take us back to the moment when you first decided to become a vet. How did all that unfold?
I honestly don't remember wanting to be anything different. So growing up, I had all sorts of different animals. We were talking before the show, I grew up in Panama in Central America. And so I had a sloth and an otter and a monkey and owls. And so all sorts of creatures. And it just seemed natural that I was going to be a vet. I do remember watching my dog have puppies and just being amazed by that whole process. And so I think I was about 5 when people, start asking you, what are you going to be when you grow up? And I said a vet, and I've never had another answer. So that's about it.
So I'm really excited to chat with you because I think, a lot of folks listening might have dogs who are suffering from arthritis or on the road to suffering from arthritis, and there might be some hidden signs there. So that's what we intend to deliver on to the audience on this show. But can we start from the beginning here? Is what is arthritis and what is it caused by, and what types of dogs tend to get it more than others based on age, breed, etc.
Yep.
So
arthritis on the most basic kind of anatomic level is where the cartilage at the joint starts to wear away. And just backing up a little bit further, where 2 bones or more than 2 bones meet, that's a joint. And the bones are lined by cartilage. And cartilage should be, if you pictured like ice, it should be nice and slippery, very smooth and white. And when that cartilage starts breaking down and wearing away, it never comes back, unfortunately. And it becomes this whole degenerative process, and we have inflammation and degeneration. And then we have other things that happen. We have the muscles around the joint start to weaken and sometimes spasm. And we have the joint fluid starts to get less viscous, so we don't get as much of that nice lubrication of the joint fluid. So there's this kind of developmental process that happens with arthritis that unfortunately at this point in time is not curable. But the one thing that I always really, really try and get across is arthritis is a really scary word. I think we're familiar with arthritis in people, and obviously it comes across as a scary word, but it doesn't have to be, because there's so many things these days that we can do to manage it. And just to kind of back up to what causes it in dogs. So your question of what dogs are at risk. In humans, arthritis is usually primary, meaning as we age, just wear and tear on the joints, we naturally get arthritis. In dogs, it's almost always secondary to some underlying condition of the joint, meaning there's some biomechanical forces that are abnormal in that joint. For example, hip dysplasia, elbow dysplasia. Those are two of the classic examples where the joint, so dysplasia means abnormal growth and development. So if we have a hip joint, kind of ball and socket, that hip joint didn't form properly as the dog is growing. And as a consequence, every time the dog walks or moves, we have that grinding essentially of that cartilage, and arthritis develops. Other examples would be a cranial cruciate ligament rupture. That's always going to cause arthritis. A fracture of the joint. So anything that is involving that joint and there's abnormal pressures. And so because of that, most of these conditions, we call them developmental orthopedic diseases. So hip dysplasia, elbow dysplasia, osteochondrosis. These are conditions that we should be able to diagnose in young dogs because they are developmental. They're starting to show up in young dogs. So segueing into hidden signs, there are early signs that we can pick up in young dogs. And it sounds sad and scary to diagnose arthritis in a young dog. But if we can, as veterinarians, if we can identify these young dogs, it gives us so many more opportunities to change the whole course of the disease process. So one of, I would say, my two big goals in discussing arthritis is, one, to promote early identification by pet owners and veterinarians. And two is to take away the stigma that it's a death sentence and it's a scary word, because as long as you approach it with an outlook that we can do something about it and work with your veterinarian, there are so many things that you can do. The last little thing I'll say is that we know that dogs that are overweight have a much higher incidence of the severity of arthritis and literally the progression and development of it. So dogs that are at risk are certain breeds, large breed dogs, Labradors, unfortunately Golden Retrievers fall in there, Rottweilers, Newfoundlands, and basically any dog that's overweight is going to be very much at risk.
And when you say, at what age do you start looking for those warning signs, and or what are those warning signs that an owner might notice too?
Yeah. So from a veterinarian standpoint, I try and recommend vets look for certain signs at the time that they're doing their vaccines. So in certain breeds of dogs that are at risk of hip dysplasia, there's a test called an Ortolani exam that can be done at 16 weeks of age, so 4 months of age. So veterinarians ideally should be testing 4-month-old puppies for hip dysplasia. And if it's positive at that time, there's a conversation to be had. It doesn't mean that they're ever going to be clinically affected by hip dysplasia, but it means they have it. If they're negative, that's a really good sign. Many, many, many times at that age, dog owners are not going to see any symptoms that young. But what you should look for, especially in the first year of life, are things like, and this is going to be hip dysplasia, elbow dysplasia, any of these developmental conditions, but a puppy that just may not be as playful as you'd expect it to be, or they are sensitive around certain areas. So hip dysplasia is a classic one where they may not want to be pet on their, along their hips or their back, or bunny hopping gait, where the sort of an abnormal motion and gait where it's described as bunny hopping. For front leg lameness or elbow dysplasia or shoulders, it's sometimes a little bit trickier to identify, but you're going to look for more like a head bob or anything that just looks abnormal when the dogs are moving around. Not wanting to jump in and out of the car, on and off of furniture, anything that you'd think is just, gosh, I didn't expect my puppy to be this slow, or not wanting to be engaged in activity.
Got it. And so the second piece that you mentioned of wanting to reduce the stigma. So what is the typical narrative that happens either in the mind of a vet and or an owner when they hear that their dog either has arthritis or is prone to it?
Yeah. So I think it falls in a few different categories. If I'm speaking to a dog owner of a puppy, or a general practitioner vet is seeing a young dog, a puppy that comes in for itchy ears or something other than arthritis. it becomes hard to have that conversation and bring it up and say, actually, by the way, I need to tell you that your dog has arthritis. If I'm seeing them as a referral clinic, it's usually that there was something wrong, and they come to me and I'm saying, yeah, your dog has hip dysplasia. And, recently I did have a case where this dog had been adopted specifically to be the dog owner's running buddy and hiking buddy. And they had this vision that they were going to be doing all these activities with the dog. And when I told them that, this 7-month-old dog should not be going running with you right now, honestly, no 7-month-old puppy should be, but especially one that has hip dysplasia, it sort of crushed their vision of what having this dog was going to be. Unfortunately, that's hopefully not what most pet owners are about. They're going to love their dog no matter what and change and adapt to the individual situation. But I think it can be really hard because you have this vision of what you're going to do with your dog. And immediately I'm saying, or veterinarians saying, we're going to have to alter the activities that you do with your dog in order to protect them and minimize the impact on their joints. Mm-hmm. When we look at older dogs, so I think people almost expect many times that as dogs age, they're going to get arthritis, that it is a disease of older dogs. So when we start having that conversation, it becomes in many ways easier because, oh, my dog's getting old, they're slowing down. Yeah, he's probably got arthritis in his hips. So it's an easier conversation, but we've missed a window of time that we could be changing that whole disease course, most specifically, honestly, talking about weight management and the activities that the dog could be doing.
And so what are some of those, maybe they're not necessarily preventative, but mm-hmm. maybe they are mitigative in that can happen throughout a dog's life once you mm-hmm. know that the dog either has arthritis, is on the path mm-hmm. to it, or is prone to it. What recommendations do you give dogs as early as 2 years old, let's say?
Yep. And even younger. I would say the most important thing is making sure that they don't get overweight. So there are studies that show that dogs that maintain a lean body condition. So I have Labradors, and sometimes people tell me or they don't know my dog is a Labrador because he's on the skinny side of normal. That's good. That's what you're aiming for. So you want dogs to be on the skinny side of normal. Certainly not emaciated by any stretch, but they need to be lean. Scientifically, this has been shown not only to delay the progression of arthritis and the severity of it, but it actually has been shown the dogs can live longer, like on 2 years longer, just by weight management. And so playing into that, it's usually about making sure that you're not overfeeding dogs. So going into what is the best diet is a whole other kind of can of worms or topic we can get into if you'd like, but it's mostly about talking with your veterinarian about what the right diet is and just making sure you're not overfeeding. Treats are okay. They shouldn't make up more than about 10% of the dog's calories every day, but treats are an important part of training for young dogs and the bond. So just not overfeeding. So weight management, can't harp on that enough because it is the most important thing. Along those lines, and this is where we get into a little bit more gray area, but the current debate about when to spay and neuter your dog, and I'm sure with golden retrievers, you're very familiar with the challenges that we're facing of when and if we should spay and neuter them. What I will say is that if your dog is spayed or neutered, their metabolism will slow down by about 30%. So they are much more likely to gain weight, which is then going to make them more at risk of developing any sort of orthopedic disease, including arthritis. And so with golden retrievers specifically, I do try and wait till they go through maturity, before having that discussion of if or when to spay or neuter. Can
I dive in on that real quick?
Yeah.
Okay. So 2 questions. One is, in general, what is the right age and or the number of cycles in the case of a female to spay or neuter, or where do you fit in that spectrum? Because it's different views.
Oh yeah. Well, I don't think we have the clear answers yet. Where I fit is really, really intrigued by the fact that when I was in vet school, I was taught you spay and neuter every dog as soon as you can get your hands on them. And there's no consequences of that. We're just population control. And so I'm glad that as a profession and as population, we're recognizing that taking away their sex hormones obviously influences the rest of the body and physiology. What we don't know yet is all of the answers. So Males are much, much, much easier. My stance is wait as long as you can. So wait as long as you can in terms of behavior. There's no benefit to neutering a dog young. Eventually,
from that dog's individual health perspective.
From that dog's, yes. And I actually should clarify that what I'm talking about is an individual pet dog. When we're talking about population control and shelters, that is a whole other story. But if this is one dog owner with their puppy and they're making this decision of when to spay and neuter, male dogs, wait as long as you can until behavior becomes an issue. And with
why did you say males are easier?
Because from a, so for females, we have the question of mammary cancer and mammary tumors, because there's this pretty old study at this point that showed that if you spayed a dog before their first heat cycle, they were virtually protected from any sort of mammary tumors. If you waited after one heat cycle, then their risk went up. After 2 heat cycles, then it went up, and it's almost equivalent to not spaying at all. So that research in particular is actually being debated of how accurate is it. What I believe it's actually pretty breed dependent too. So there are certain breeds of dogs that are at a greater risk for mammary tumors. So spaniels, dachshunds, poodles, some of the smaller breed dogs, they have a greater risk of developing mammary tumors. So, and those also dogs are less at risk of developing orthopedic disease. So in those cases, so if we're talking about females, if I had a female Cocker Spaniel or a female Dachshund, I would probably spay them at 6 months before their first heat. Now, if we're talking about a female Labrador or a female Golden Retriever or giant breed dog, this is where it becomes a little bit trickier, but most of the time, if it were my dog, I would probably wait until they were full grown. So 1 to 2 years of age.
And sorry, go ahead.
I was gonna say, with males, again, there's no protective reason to neuter them early. So letting them stay intact, if it works for so many working dogs and many agility dogs, they are not spayed or neutered. Mm-hmm. But you have to be very, very cautious about, not breeding unintentionally and, some other things that can go along with it.
Intact. That's a good way to put it.
Intact. Yeah.
So on the female side, is the issue with spaying, is the issue primarily driven by the metabolism point, in that is likely to result in more weight gain, or is there another potential mechanism in the body that makes them less likely to get arthritis or other issues?
We don't know. So I'm sure that weight gain does have something to do with it, but there's some research being done, at a few universities I know of that are looking at certain receptors that, not going to go into all the hormones because it's a little bit out of my wheelhouse, but when you spay the dog and you take away their hormone producing, there are certain receptors that become overproduced. And it's possible that those may have new roles that we just aren't aware of and not sure of. Mm-hmm. The other part is, if you spay or neuter before the growth plates have closed, the growth plates actually stay open longer. So it's counterintuitive, but dogs that are spayed very young tend to be taller. So their bones are going to get longer, versus if they are spayed after they've gone through puberty and their growth plates have closed, they tend to be shorter. Mm-hmm. And so what we don't know is the biomechanical influence that has on the joints. So I wish I had a clear answer for you. I look forward to the day we do.
And when you said that their metabolism will decrease by 30%, mm-hmm. to what extent is there any research and or thinking around where in the growth cycle that happens? So if you spay them at 2, is it then 30%, versus if you spay them at 4 or 5, maybe it only reduces 10 or 15%? Is there any thought around that?
I don't know the complete answer to that. My assumption and my understanding is that it doesn't really matter when. It's that those hormones are now gone, and the way I describe it to clients is like a woman going through menopause. It just, everything slows down. Mm-hmm. And so if so I do laparoscopic spays on dogs, and usually when I'm seeing them, it's because they're larger or an adult that is, it's not a very easy spay at that point. But even if they're a year old versus they're 5 years old, I'm still going to have the same conversation with the client. If you're starting with a younger dog, you have more opportunity, more years to pack on the weight versus an older one. But I don't have a scientific answer for you. I'm sorry.
Okay. So we talked about one lever there, which is metabolism and the impact of spay and neutering on that. I'm down to go down the rabbit hole of diet. So
Sure.
any, thoughts there in terms of looking at that? There's a number of lenses to look through that, through whether it's weight or inflammation or genetically appropriate. So what are your thoughts and philosophy in general?
Yeah. So I'll preface by saying I'm not a nutritionist. But the interesting thing about diet is both on the human and the veterinary side, people are so passionate about their philosophies, whether on the human side, you're vegan or you're keto or paleo, or people have very strong opinions and very passionate. And across both spectrums, we still don't have the right answers, which is why people can be so passionate. So I'll share my personal philosophy, which is the diet should be complete and balanced. And there's no time that's more important than when the dog is growing. So a growing dog should be on a veterinarian formulated, complete balanced diet, because if it's not, then the calcium and phosphorus can get all out of whack and we can have significant issues that pop up. Once a dog is full grown, there are a lot more options, I think, in terms of complete and balanced diets. The way that I look at it is fresh food is best. Kibble is highly processed, whether it is, you go to your local supermarket or you get the fanciest brand kibble out there. It's all highly processed. But it's very convenient and it's cost effective in many ways. On the other end of the spectrum, there's raw diets, of which I'm not a proponent of, just because I've never seen scientific evidence to say that it's worthwhile. And we certainly see the consequences of infections and zoonotic disease and stuff like that. So I'm not personally a raw diet proponent, but I am very much a fresh, whole food, cooked diet proponent. And so whether that is home cooked food or there's a number of services now that make fresh cooked food. So the one that I feed my own dog and recommend to clients mostly is called Just Food for Dogs. But there's a number of them out there. There's Evermore, Nom Nom Now, a lot of different ones out there with cooked food. It's never been harder to have conversations about diet than now when, everybody thought they were doing the right thing by going grain-free or, changing the ingredients. And now with the issue with the dilated cardiomyopathy and certain diets, I do feed kibble to my dogs because sometimes I have to, and it's just time saving wise. And I was feeding some of those diets that now have shown up on the FDA list. And so when it comes to what the best kibble or the right kibble is, I don't know. I feel like every dog is different. So I have my oldest dog who does have arthritis. She's on Science Diet JD because she also has kidney issues, and it's a low protein diet. It's high omega-3s, and she's thriving. She's doing great on it. My Labrador is on Just Food for Dogs, and then I rotate through other brands of kibble just to see what I can find. Mm-hmm. Yeah.
Got it. From a weight management perspective, is there any approach that you recommend to patients or that you've seen work?
I think it's going to be it's going to be dependent on the pet owner, the client, and from my standpoint. And unfortunately, it comes down to a lot of times the costs, the cost of the food. I do think that fresh cooked food offers opportunity for weight loss easier. There's just less junk that you're feeding them that the body has to deal with, but it's going to be much more expensive. There are specially formulated weight loss diets from all of the big names, Purina, Royal Canin, Science Diet. And I have seen very good success with some of those. And then everywhere in between where we can calculate how many calories a dog should be eating and then potentially cut back on what they're currently getting. Now, nutritionists will say that if a dog is more than about 20% overweight, that just cutting the number of calories that they're getting from their whatever dog food they're getting may make them may change that nutrient profile, that they're not getting all of the nutrients that they need. So nutritionists will say that if a dog is needing to lose more than 20% of their body weight, then they should go on a specifically formulated weight loss diet. So I've used a variety of different methods, and it's really dependent on the client, their financial situation, the practicality of, I'm not going to cook dog food, I'm not going to buy dog food, I need kibble. So we'll talk about that.
Okay.
So I don't think it's a cookie cutter or one size fits all.
Sure. Now, also on the weight management side, I'm guessing that exercise is a part of this, especially since that's what your ebook, your download there that's free on the site that people can go to, 7 Principles of Exercise at caninearthritis.org. So can you talk a bit about that?
Sure. I think exercise is definitely important, and it's going to help with weight loss, but it's about 10% of it. So if anybody who's ever tried tracking calories, if you're ever trying to track your own personal calories in versus calories out, it takes a lot to burn the number of calories that are equivalent to what you're taking in. So for me, exercise is part of weight loss, but it's even more part of just general fitness and arthritis management, from the standpoint of keeping the joints moving, keeping the muscles strong, and keeping the body, in terms of balance. As dogs get older, they need to work on it. So there have been studies that show that dogs that walk for a longer period of time in a day, so anything more than 60 minutes in a day, and they have arthritis, they have less clinical symptoms than dogs that walk less than 20 minutes a day. Now, going for an hour walk every day sounds great, but I know that many people can't do that. I don't have time in my day to take my dog for a walk every day for an hour. But any sort of regular controlled walking and low impact is going to be very, very, very helpful for dogs with arthritis, and potentially help with their weight loss.
And so what about walking in, one of our previous guests, I think Dr. Francisco Maya, who's a canine physical therapist, he'll end up, putting dogs in kind of awkward moving situations, like even walking them kind of down a narrow alley so that they're trapped, and then they have to kind of walk backwards. As ways to strengthen the muscles. So are there any other sort of techniques like that you see that, beyond just the sagittal plane of walking forward?
Yeah. So the backwards walking is one of my favorite exercises. We have a link to how to do that on the website. But if you're taking your dog just for a walk, a few things that you can do is just weave on and off the curbs so that they're having to step up and then step down. And that's a great one for puppies that are learning body awareness, and they need to learn, hey, I've got 4 legs, I need to learn how to use them. So weaving on and off the curbs. And then every time you come to a crosswalk, have your dog sit and then stand. It's working on basic obedience, but every time they do that sit and stand, we call it a doggy squat. So that's a great one. Also, just walking on different surfaces. So walking on pavement or concrete is going to be the most high impact, and it's not necessarily ideal, but having that sensation under their paw pads is good for some period of time. My preferred area to walk on is going to be some sort of trail where they're stepping over sticks and feeling different surfaces underneath their feet. That works on something called proprioception, which is basically the body's awareness of where their feet are in space.
Okay. Now, what is the mechanism by which stronger muscles result in less inflamed or more lubricated or healthier joints? Because I'm thinking, you said earlier that the cartilage, once it's damaged, it doesn't grow back. And I'm thinking from my own experience of, I do relatively strenuous, high intensity lifting and gymnastics type of stuff. And from time to time I'll get joint issues, but I'm just curious, like so how do stronger muscles result in stronger cartilage, which is not able to regenerate? Yeah,
it's not a direct correlation. So stronger muscles are not going to help regenerate cartilage. They're not going to change the inflammation so much in the joint, but they'll be able to help support the joint around it. So we know in dogs that have hip dysplasia, by strengthening the muscles, the hip muscles, many times they're never going to need a hip replacement or an FHO. Likewise, the shoulder joint, we can be very effective with strengthening all of the muscles around the shoulder. when we start getting into toes and carpus and elbow and any joints that are further down where there's less muscles surrounding them, there's just less ability to make them strong. I go to my own physical therapist, and similar to you, I do a lot of weight training because it's I'm developing arthritis in my neck and my shoulder, and so we do a lot of strength training to try and keep those muscles supporting the surrounding structures, but it's not directly decreasing the cartilage damage itself.
Okay. Now, so one thing that I do before I am doing any sort of heavy lifting or anything else is, I'm warming up, I'm getting blood flow going, and then I'm also foam rolling, which, loosens the muscles up a bit, but also the fascial tissue. And so to what extent is that beneficial for a dog, and or how do you go about doing that? Because, I can't picture, being able to train your dog to roll around on a foam roller.
Yeah. Well, the first part of warming up, absolutely. So anytime a dog is going to be engaged in any heavy activity, they should warm up 5 to 10 minutes of a gentle walk. So that's pretty easy. And it's a lot of times what we'll talk about with our canine athletes, and even just dogs that if they have arthritis, before they go to the dog park, go for a 5 or 10 minute walk first. Foam rolling, I wish we could figure out a way to do that, because I know it's been incredibly important for me as well. Physical therapists, as you mentioned, you had one on your show, human physical therapists that are trained in working with canine patients have such an amazing ability to be able to work on some of that fascia. But as you know, foam rolling is not comfortable. So I don't think that we're able to do quite the same level of impact that would probably benefit them. I have no doubt that dogs do suffer from fascial inflammation, and we see trigger points, and we see, myofascial pain, and we can treat it with manual therapy. So whether it's a human physical therapist or a veterinarian trained in manual therapy, there are certain techniques that we can do. We'll teach clients to do some basic massage, but to try and get them to do cross friction massage or fascial movement, I think is not pleasant for the dog many times. People that do acupuncture or trigger point therapy will do some of that needle work to help relieve some of those areas.
And what about the Theragun, for example? I mean, the Theragun is basically, I think it's just a jigsaw that they put kind of a massage device on the end and some branding on it. But it's for human, but it's moves back and forth very quickly and provides almost just continuous trigger point. And fascial release also. What do you ever see that used on dogs?
We call it, well, what I'm most familiar with is shockwave therapy, which is a horrible name. It's not shocking, but it's high intensity ultrasound therapy. But in that category also includes what you're describing, which is kind of this jackhammer. I have not used it personally. I do use a form of shockwave therapy, which is the dogs have to be sedated for it because it's not comfortable, and it's quite loud. I do have some colleagues out there that have played around with some of the other less intense. I haven't seen any research to support it yet, and I haven't had any direct experience. Again, I think, at least in my world of rehab, we're trying to make everything we do with the dog to be a very pleasant experience. And so we have to really balance that. Doing a technique that may or may not help versus the dog ever wanting to come back to see us and do the exercises that we know will help them. So I think fascial and myofascial pain and treatment is a huge part of what we need to do. And we're still in the early days of figuring out how to do it best with dogs. Got it.
Yeah. And the Theragun is also extremely loud. So
exactly.
It's loud for a human. What about supplementation to include, the typical ingredients like fish oil, glucosamine, chondroitin? We have some pretty unique green lip mussel in the Sunny's formula, for example. BCM 95 curcumin. Those are probably the main ingredients that are intended for healthy joints in the golden retriever products. We have, I'll make sure I get a product shot there, and also to include CBD.
So the supplement world it's huge, as you are very, very familiar with, and I would say almost every client that I see, their dog's already on a supplement, and from a research standpoint, the research and the evidence hasn't quite caught up with the market out there. Each individual ingredient, though, I think there is research to support it. Does each bag have its research to say this is the best thing for your dog? So when I'm talking to a client about all the things that they can be doing, especially for early on, certainly using a supplement is probably going to help those joints. So you mentioned green lip mussel. So that's one of the newer ones that can have some great anti-inflammatory, antioxidant properties. Curcumin, another anti-inflammatory one. Glucosamine chondroitin is the tricky one, and maybe things that I don't, but the research just hasn't supported those two ingredients to be as helpful as we initially thought. I personally think it's some of the other ones, the green lip mussel, the curcumin, that are probably having the benefits that we see. And then CBD, absolutely, that's the one. Again, I live in Washington, so most of my clients have already prescribed their dog some form of CBD. There's something to it for sure. We know the endocannabinoid system is alive and well in the dog and in the human, and it plays a role in pain management in addition to many, many other things. So I do prescribe CBD and several different products.
Okay, got it. So I guess we have a few more minutes here. Can you kind of rehash some of those hidden signs again? Maybe, and break it into maybe a younger dog, medium-aged dog, older dog, just for our listeners, so they can, take that home, and then we'll wrap up.
Absolutely. Yeah. So in a younger dog, it is harder to identify, and that's why we don't make the diagnosis quite as common. But if you have a young puppy, things to look for, just number one is any abnormal gait. If they just seem to limp or be stiff after they get up, or this bunny hopping gait where they just run and both back legs are moving at the same time, or they're shifting weight off of one leg or the other, especially if it's after play or heavy activity, or when they are first getting up in the morning, that kind of stiffness. Or in a young puppy, if they just don't seem to have the energy or want to play or be as vigorous as you would expect for a puppy. Those are all things to go to your veterinarian, and it opens up the opportunity for a conversation. Throughout middle age, that's a lot of times where dogs are thriving, they're doing pretty well. But again, it's any sort of limp. So I'm always amazed that people will say, my dog's limping, but I don't think that they're in pain. Well, limping is a sign of pain. As dogs get older and the true pain component of arthritis sets in, then there can be signs that are a little more subtle. So it's really, really rare that a dog's going to cry out in pain or they're going to whimper. That's a big deal pain. It's usually changes in their behavior. So they don't get up to greet you when you come home. They stand at the bottom of the stairs and look up and don't want to go up or go down. They have trouble jumping into the car, onto the bed. Then there's some things that are, I think, less appreciated, like over grooming an area. So dogs that overlick their front leg. I think in the past people said, that they've got obsessive compulsive disorder. We're now recognizing that there's a pretty good chance that they've got pain somewhere through that, from that neck down to the paw, because there's radiating nerve type pain that can result. So over grooming of an area, over licking, not sleeping through the night. So just kind of restless, getting up and not being able to get comfortable. Like, on the other hand, dogs that just don't want to get out of bed. They're just, I'm comfortable. I know if I stand up, I'm going to have a hard time getting around. And then, the other thing is, it's literally just the dog's personality. And this is not super sciencey, but it is recognized now by all of the pain governing bodies in the veterinary world, is if your dog seems sad, dull, or depressed, those are signs of pain, and they're most likely related to arthritis.
Wow. Okay, good list. Well, I think we covered a lot here. Super helpful for our listeners, and I definitely learned a lot. So, Dr. Kristin, anything else you'd like to share with our audience?
I think that about covers it. Everything that we've talked about here and more, you can find at caninearthritis.org. And certainly any other topics that I don't have on that website, we have an email. You're always welcome to send requests for new topics for me to cover. Okay.
Sounds good. Well, Dr. Kristin Kirkby Shaw, you can learn all about her at caninearthritis.org. on Facebook at Canine Arthritis, Instagram at canine_arthritis_resources. And on our website, you can get a free copy of the 7 Principles of Exercise. Thanks so much, Dr. Kristin.
All right. Thank you so much.
Okay, take care.
You too.